Well, good evening, Facebook Nation. It's Wednesday at 9 p.m. So, what are we doing? Of course, we're sitting back with a cup of ice cold lemonade, and we're sitting here and we're talking about mental illness, which is a very important thing to talk about, as always, this being Mental Health Awareness Month. Um, it's a pleasure to be here today. These videos are being sponsored by my mom, Teresa Smith, who, interestingly enough, was had an article written about her in the New Albany News and Tribune yesterday about her experience having two sons commit suicide. So I strongly recommend that. As always, feel free to share these videos with anyone that you would find helpful. They'll be on Facebook, and then tomorrow I will have transferred these to a YouTube link and put that on there so that you can share them with friends easier if it's simpler to do it that way. As always, if these videos are helpful, I placed a link to my mom's Out of the Darkness walk where we raise money for suicide intervention. And so all you have to do is click on that link and make a donation if you have found these videos helpful. Today we are going to be talking about the role of anxiety and depression when it comes to suicidal thinking. And these are two of the biggest factors when it comes to suicide. Other forces may play a role, such as substance use, but anxiety and depression are the driving factors. So let's talk about depression. There's a lot of misconceptions when it comes about depression. First of all, it's more than a depressed mood. So I'm an Indiana basketball fan, so I deal with a depressed mood early and often. My team hasn't won a championship since 1987, which is difficult to deal with. But when we're talking about depression, we're talking about a pronounced depressed mood that lasts for up to 6 months. And it can manifest into a lot of different ways. It has some biological factors, meaning you can have increased or decreased appetite. You can have hypersomnia, which means you sleep too much, or insomnia, which means you have trouble sleeping at all. You'll have problems with suicidal thoughts. You'll be slow moving, decreased motivation, and one of the things that I think is really annoying is just not enjoying the things that you used to enjoy, just not finding any enjoyment in that whatsoever. So it can be a lot to deal with. There are several functioning levels when it comes to depression. A lot of the people I talk to are in the functionally depressed category, which means that they can do the things that they absolutely have to do. So if they have to take care of their children, they'll take care of their children. If they have to go to work, they will make it to work. But it will require all their strength and all their motivation to do these necessary things, and then that's it. That's all they got. And there are some people where it takes significant motivation for them to do things like take a shower or fix a meal for their children. And they have to really push themselves to do these basic things that other people might take for granted. just telling them, well, you'll have to pull yourself up by your bootstraps, is not going to be that helpful. Um, the I really admire these people because it can be very tempting to withdraw into yourself and not do any of these things, but they find ways to accomplish the basic tasks set before them. There are some people who I've worked with who have had very severe depression, and so much so that they just do not leave their bed. They don't do anything, and it can be really hard to get a handle on how best to help these people. Depression is a tricky issue on a lot of different levels. One, and this is a hard thing for people to wrap their head around, is there's a lot of selfishness that goes along with depression. People who are depressed, they obsess over their way of thinking, and they're only considering things from their point of view. So it takes some talent to be supportive of the person, but also challenge them to consider other people's needs and the things that they are going through. Hello, Mr. Conley. It is a pleasure to have you with us. We got a celebrity on board. So a therapist will really look at how the individual is thinking and try to challenge their thoughts. And that's what I do a lot. I'm a cognitive behavioral therapist. So an individual who is depressed is having some thoughts that are not accurate. And as the therapist, I am going to be challenging those thoughts. And so, as Obi-Wan Kenobi taught us, only Sith thinks in absolutes. And that also applies to depressed people. Depressed people will often think, no one likes me, things never go my way, I always have to struggle. But really, things are never permanent. They fluctuate all the time. Hello, Miss Martha. It's a pleasure to have you here. So you're challenging. Hello, Mr. Brown, one of my favorite Chilean missionaries of all time. Hello, Ashley. Hello, Lori. We got a good crowd here tonight. The other things that depressed people have a problem with is they are option eliminators. So you will say, well, how about this? And they will say, well, I can't do that because, and that is difficult because. And there is a technique that you use. I learned this actually from Bob Bethany. It's called the concept of sweetly bold. So you have a smile on your face while you're telling them something that's going to be hard for them to hear. So when you're encouraging them to do something different than they have not done before. So like, hey, let's go walk the pedestrian bridge. I'll walk with you. You're going to do that with them. You're not just telling them, you need to do this. I'm going to do this with you. And to facilitate them making a change and doing something different than they had done before. To see the world differently than they had before, that there are options available to them, and that things aren't always so bad, that there are actually good things that have happened in their day. One of the things that is really interesting about depression is people are least likely to commit suicide in their deepest parts of depression. I know, that sounds a little odd, but I said that right. one of the reasons is they don't have the energy to complete a suicide attempt. I mean, that takes a lot of work. You got, my wife gave me the look on that one, but it's true. They don't have the energy to follow through on their plans. They'll have thoughts and they'll have ideas, but they won't follow through on their plans. Actually, as psychologists, we get concerned when we have a depressed person and they are just starting to feel better, because they're still having those negative thoughts, but now that they're feeling better, the energy is coming along, so they have the energy to act on the thoughts that they've been having. And that's when we get very concerned. So let's talk a little bit about medicine for a minute. As many of you all know, there is a popular class of medications called SSRIs, selective serotonin reuptake inhibitors, which is just a really fancy word to justify me making money. But it just means that we're using our serotonin more effectively. And on these class of medications, which are commonly the first line of medications prescribed to individuals with depression, there is a warning box saying that an individual is at risk for increased suicidality when taking this medication. Now, that can be very confusing, because why would you take a medication that could lead to increased suicidality? And it leads to a lot of misconceptions about the medicine. Now, first of all, this warning on the medicines is very controversial. And amongst the mental health community, us psychologists and psychiatrists, we're not a big fan of this warning. The research is kind of flawed, and it's a little nebulous, and it just doesn't paint the full picture, because what's going on is that the person is taking the medication and then they are starting to feel better, which gives them more energy and thus more likely to make a suicide attempt. So the medication is working, and that is why the best form of treatment is medication plus therapy. Because the medication is all good and that's helpful, but you want to have the therapy so the therapist can work on changing your cognitions. Hey, Ray, it's good to see you. Don't worry about being late. This isn't the first time you came up short. So that is why medication and therapy is so important. Now let's get to another just quick soapbox issue that I've been having. There has been a lot of coverage about school shootings, and that is an important thing to talk about. And believe me, we need to be talking about how to improve mental health in America. Now, some people have been saying that these individuals who have been doing school shootings, they have been taking medicine in the past and then weren't taking it, and then they did the school shootings, so the medicine must cause the school shootings. Now, this is quite possibly the stupidest thing I have ever heard in my life. And I do a lot of work in Kentucky. I mean, it is the dumbest thing I have ever heard. It is dumb on so many levels, I can't even tell you. Of course, they were taking medicine. They're depressed. And maybe they should have kept taking their medicine. And if they had kept taking their medicine, maybe they wouldn't have engaged in violent behavior. If you want to see increased aggressive, inappropriate behavior, then have people not take medicine. But let's not go to people just spouting off their opinions somewhere to get our mental health information, but let's look to educated people like myself. um, always here to answer your mental health questions. uh, when we're looking at depression in teenagers, actually, it even gets that much more difficult because the diagnostic criterion for depression is written for adults. So to be diagnosed with depression, you have to have 5 symptoms of depression for a 6-month period. Well, 6 months is like 3 years in teenage land, and that's a long period of time. Also, one of the things that does not get mentioned in a diagnosis is that a lot of the ways teenagers show their depression is through irritability. I don't know if you've all ever seen irritable teenagers, but they're out there, and they can definitely be difficult to deal with. In dealing with depressed people, we are trying to break habits. We are trying to get them more active, doing things outside of their comfort zone and different than what they have done before. Okay, we'll talk a little bit about anxiety. Anxiety, in my humble opinion, is hell on earth. It is, of all the disorders, the one that makes you think like you are going crazy. Okay, now to help us discuss anxiety, we have a special guest with us today. All right, so could you introduce yourself to Facebook Nation?
My name is Andrew Warren Smith, and this isn't just Facebook, Dad. This is YouTube.
Yeah, it'll be on YouTube. All right, and how old are you?
I am 10 years old.
Okay. Now, do you ever struggle with anxiety?
Yes, I do.
Okay, can you tell the people on the internet what it's like to be a 10-year-old kid with anxiety?
Being a 10-year-old kid with anxiety is hard sometimes. I mean, you never know what's going to happen. I mean, it's hard. It's really hard. It's always going to be, a little thing is always going to seem like a big deal sometimes. And the big deals will become really big deals. You have to try to find the calm center. But being a 10-year-old kid with anxiety is hard.
So what kind of things do you worry about?
I worry about many things. I worry about like my family. I mean, that could be a thing too. Where sometimes you think a person you really like dies, and that's really sad.
And what do you do to feel better?
I cuddle with my mommy or daddy, and it makes me feel better.
Okay. Is there anything that you would like the people of the internet to know that would help you when they're dealing with somebody who has anxiety?
It's a good idea to try to find something that makes you laugh, like the well-known, like this person's name, like this YouTuber named Stampy Longnose. He makes daily videos that are really funny. Also, he has friends named Squid and Ash, and they all have very funny videos that can make you laugh. By the way, there's something like on this side of the screen where it looks like you can like text, and I think I just saw Emily Smith someone named Emily Smith put a hi right there, and then the like. And there's still people coming in.
Hey, say hi to Tabitha.
Hi Tabitha. It says you just joined.
That's your Weebelows leader.
Weebelow leader. Mommy's saying it's me, and Mommy's just over there in our living room.
Okay. Well, would you like to say? Oh, she's saying hi.
Hi.
All right. Would you like to say good night to the people of the internet?
Good night to the people of the internet, and please subscribe and slap the bell, put the like button on, and do anything else that you can do because Minecraft.
Good night. Okay, that was Andrew giving us his insights into what's it like for him to have anxiety. Let's see. Martha, I saw your comment. It is, you know, it is always interesting people taking their opinions of what they read over the internet over the trained therapist. Let's see. Okay, so it is it is really hard that teenagers don't reach out more and get help when it's available, and that is one of the things that my family and I really work towards to increase the awareness of mental health services and try to take away the stigma. When I was growing up, there was such a stigma against getting mental health and even talking about it. Or reporting bullying or anything. It just, I mean, when I did report bullying, I was told, well, it's just part of growing up. So, what we do in our family is we sacrifice some of our privacy in an effort to try to let people to take away the stigma and let people know of available resources. We want people to know about the 1-800 crisis lines that you can call anytime, the text lines that are where you have a trained mental health provider who will text to you 24 hours a day, 7 days a week. Free. 741-741. It's easy. And that is why we spend these Wednesday nights together talking about this, because it's such an important issue. When we're anxiety is one of the most difficult issues to deal with. Of all the disorders, this is the one where people feel like they are losing their mind, that they are going crazy. People, for one, they know their thoughts aren't making sense, and they are just so overwhelming, and they don't know how to control them. I think about it like when it comes to RPMs on a car. So, as an individual who suffers with anxiety myself, all during the day, my anxiety level is at least somewhat elevated. It's never zero. If I'm awake, there's some anxiety going along. Now, if things are going well, maybe it's like here. But if things are going bad, then they're right here. And it is it's a constant battle of knowing where your anxiety is at, using your coping resources effectively to get that level back down, and putting yourself in the best possible condition. And it is a daily struggle. It is something that I deal with every day throughout the day, monitoring my anxiety level and planning accordingly. If I know that I'm going to have a day different than normal, because different is bad sometimes, and then I'm going to make sure that I have coping resources that work for me available so I can combat that appropriately. So the first part about anxiety is you have to have open communication. And so that means having a trusted person that you can discuss your anxiety with. I've really appreciated here some of the people who have been making comments and also been sharing their experiences with anxiety, because I think all of this helps reduce the stigma related to depression and anxiety. When we're looking at the management of that disorder, in its most extreme form, we have panic attacks. And panic attacks are absolutely horrible. I have had several in my life. They are not pleasant. They can come sometimes to the people who suffer anxiety. They can come what seems like out of nowhere. One of the worst anxiety attacks I ever had in my life came because I was putting leftovers in the refrigerator and I couldn't figure out how to put the leftovers in the refrigerator. Um, it's the straw that breaks the camel's back. Um, when you have a panic attack, it feels like you're having a heart attack. 50% of the people that go to the hospital thinking they've had a heart attack are actually having an anxiety attack. And unfortunately, I'm concerned that if I ever had a heart attack, I would just assume it was a panic attack at this point. So,
great. Thank you for that information.
Always willing to lift up the mood of my wife and help her feel better. Yeah, a lot of what helps as we are approaching near panic attack levels is breathing. Now, I know this sounds hokey, and when I was studying it in graduate school, I was like, really? Breathing? That's going to help me? I breathe all the time. I got it. But I have to tell you, I have done it. It really works. Now, what I like to do, let's see, I got here, make sure, get the full format here. I like to put one hand on my chest, one hand on my belly, because when you're relaxed and you breathe out, that belly's going out further. But when you're anxious, the chest goes out further. So you want to be making sure that belly's going out. And so if I am just feeling anxious, I'll put my hands on my chest and my belly, and I'm making sure my belly's going out all the way. And just take nice, slow, deep breaths. And that, as hokey as it sounds, I'm telling you it works. I'm telling you it works because it has worked for me, and it has worked for other people that I've worked with. So the other things that you want to consider are, if you can, remove yourself from the situation. If you can go outside and get some fresh air, if you can go take a shower or a bath, read a book, put something mindless on TV, whatever works for you. There are very few situations in this world where you have to stay exactly where you are. There are some, believe me, there's sometimes when you're at work and it's very tough. But many times there are places that you can go. And I strongly recommend the bathroom. Generally, when you tell someone that you have to go to the bathroom, they let you go. And I have done a lot of breathing exercises in bathrooms in my time. Actually, when I used to work at the prison, that was my go-to place to go because I didn't want to have a panic attack in front of the inmates. So the bathroom was a good place to work on my breathing, and I'd be left alone. And one of the few places where they did not have cameras in the prison was the employee bathroom. So have that going for me. It is important to have somebody close to you who you can communicate your anxiety with, who you can tell that person that you're feeling anxious, and they will listen to you without judgment. Now, it can be hard to talk to somebody who is feeling anxious. The tendency that many people have is they want to fix the problem. Well, and that is very good, and that can be helpful, but not when somebody's really anxious because the thoughts aren't even making sense, so it's really hard to fix anything. And so it is best to provide a non-judgmental opportunity to just listen to the person, just hold the person, and just let them say whatever they got to say, and get that out. One of the most beneficial things for me in dealing with my anxiety has been exercise. Just cardio work, getting that heart pumping. I think it was a real blessing when I was going through internship, that I was able to do a lot of exercise and get some of that anxious thinking out of there through doing that work. There's a lot of different coping exercises out there. There's a lot of different coping strategies, all good to talk with your therapist. Now, some coping strategies are better than others. One that I don't like is cutting. Bad. I have problems with cutting on several levels. One, I'm anti-pain. Two, there's just so much risk for escalation, infection, and things getting worse. Now, cutting and other self-injurious behaviors are more common than we would like to admit. I had this one lady at my church tell me, Josh, it's just so good that there's nobody in our church who cuts themselves. I was like, I wish that was true. But it does happen. So if it's going on, it does happen. And it is something that needs to be discussed with a therapist. But we don't necessarily need to freak out. But we do need to make sure the person gets help and can talk to someone in that area. All right. Now, when it comes to anxiety and suicidality, sometimes those of us who are anxious just want the thoughts to stop. They come in and they are just never ending. For those of us who live in this area, we are very knowledgeable about the slow damage that rivers can cause. Just over time, that constant river going down over the rocks and wearing them away over time. And these depressed and anxious thoughts can just wear and wear on an individual. For me, one of the things that would go through my brain would be like how you ever had like a really slow computer and it's just not working right, and you're like, okay, I'm just going to turn it off and then turn it back on, and then maybe it'll start working. And that's kind of the thought that would go through my brain. Now, it didn't make much sense because there's no turning it back on from a suicide attempt. But I mean, it was just the constant barrage of depressed and anxious thoughts, and just you wanted a break from it. And they would wear and wear on you over time. When you have some of these negative thoughts, they can lead to what psychologists call your core belief. So many times I was told that I was a geek, that I was a moron, that I was worthless and a waste of space. And you start to hear that, and then you start to think it and think it and think it over and over again, that you see yourself as worthless, like you have accepted that as something that you believe about yourself. And that's why treatment is so necessary, to help you overcome that belief process, that you see yourself as a person who has worth. One of the things that anxious and depressed people will say sometimes is, Well, no one loves me. And I have said to these people at times, well, I love you. And they're like, you can't say that. I'm like, wait. You have your right to have your thoughts and your feelings, and I have my right to have my thoughts and feelings. And my feeling is that I love you. You can't take away my feelings. I'm not going to take away yours. And which is a completely fair thing to say, and kind of stumps them on that one. If you are dealing with somebody who is feeling anxious, you know, you're going to look at the things that are bothering them. When we're looking at anxious thoughts, we're examining them on two dimensions. First of all, how reasonable is this fear? So I talk to people all the time who have a lot of different things that they're worried about. I worry about a lot of things. Now, one of the things that I worry about is I do not like alligators and crocodiles. These are horrible animals. Listen, I have a lot of respect for the environment. These animals need to be extinct. I don't like them. I remember when I was a kid, they had this exhibit at the zoo where you could see the alligator from up top and up bottom under the water. And up top, just the little alligator nose, cutesy alligator, no little problems. And then under the water, he had his claws out like this, just ready to pounce on anything that hit the water. And I was like, that's an evil animal. And whenever I go around alligators and crocodiles, I feel kind of nervous. Now, the nice thing is I do not live in Florida. I don't know how you people do it. There are alligators on your golf courses. What are you people doing? And you see people playing the hole. Interestingly enough, today there was a lady who walked outside and there was a bobcat on her porch in Georgetown, Indiana. Don't know where that came from. But in reality, alligators and crocodiles are not the things that I have to deal with. Now, there's this other thing that makes me nervous, and that's talking on the telephone. Do not like talking on the telephone. I cannot see people. I like seeing people's faces. Really bugs me when I'm talking on the telephone. Now, that is one that I have to deal with. And so I have to confront that. I deal with all kinds of anxieties that people have. There are people that I deal with who are very concerned about a zombie apocalypse. And, I actually have a lot of concerns in this world. Zombie apocalypse is not one that I'm worried about. Of course, I don't watch The Walking Dead. Maybe this is something I should worry about. But for right now, I'm not worried about a zombie apocalypse. And I don't have any control over it either. However, if I am a person of limited means and I am worried about paying the rent, well, now that is something to worry about. And that is an appropriate concern. So first we want to make sure whether our concerns are realistic or not. And then the second dimension we examine is our ability to control these concerns. So I can't do anything about the alligator or crocodile population in the world. I can choose not to move to Florida. But other than that, I have limited control. However, when it comes to paying my bills, well, where are we at? Can I budget? Can I get some extra hours at work overtime? What am I looking at? Can I ask for help? What are the factors that I control? And then I focus my anxiety, my energy on realistic concerns that I can control. If you're going to have the anxiety anyway, then we're going to focus our efforts on what's realistic that we can control. At least that's how we do it as therapists. Anti-anxiety medicines. They're not great right now. I'm sorry. I wish I could give you better news. Uh, all anxiety medications, with the exception of Buspar, are addictive. Now, there are some people with anxiety disorders who have to take medication. Nothing wrong with that. That's where they're at. But there is a concern for addiction when it comes to anxiety medications. Uh, there are some medications that you can take PRN as needed to help avert a panic attack. And one of the more popular ones is Ativan. Very helpful. They give this to people many times when they come into the hospital and they're having an anxiety attack. They'll give them some Ativan. And I have to tell you, Ativan, I can go from anxious to sleeping in 30 minutes. Beautiful. But hopefully those medications will continue to get better.
Question.
Yes.
What about medicines that treat anxiety and depression? Those aren't addictive. It's just that they can help with anxiety while they're helping with depression, like Paxil.
Right. There are some antidepressants that have an additional benefit of reduction in anxiety, as Ms. Smith has illustrated. Paxil is one. Wellbutrin's another popular one. Wellbutrin's also good in reducing smoking cravings.
But they aren't addictive. You're talking about...
No, those aren't addictive. I'm talking about
anxiety.
Straight anti-anxiety medications, not the medications that are antidepressants that also help somewhat with anxiety, because those are an available choice as well. The antidepressant medications really have come a long way. These SSRIs are great in a lot of different ways. There's several great things about them. One, they're not addictive. They have limited side effects. On SSRIs, you can't overdose on them. You could take 1,000 Prozacs and you'd have a headache. So, a lot better than the medications that they used to have. I hope this has been helpful. Feel free to share this with anyone that you think would benefit from this. The YouTube link will be available tomorrow. If you found this helpful, please donate to the link associated with this video. And I tried to read through the comments as best as I could. I'll go through them tonight, add some more comments as needed. So hope you all have a lovely evening. And next week we will be having our final mental health and suicidality webinar. Haven't decided on the topic for that one yet. If you have any ideas, just let me know. But next week will be the 30th, so will be our last one for Mental Health Awareness Month. I hope you all have a good evening. Thanks. Good night.